Millions of Americans are injecting this drug every single week. And while the weight loss results are real, there is something the commercials never show you. Ozempic. Its scientific name is semaglutide. It was originally approved by the FDA in 2017, not for weight loss, but for type 2 diabetes. It works by mimicking a hormone in your gut called GLP-1. That tells your brain you are full. A landmark study published in the New England Journal of Medicine in 2021 found that patients on semaglutide lost an average of nearly 15% of their total body weight. That is not a small number. For a 200-pound person, that is 30 pounds. But wait, if this drug is this powerful, why are doctors now sending out warnings? The most commonly reported side effect, and this affects up to 44% of users, is nausea. According to the FDA Adverse Event Reporting System, thousands of users also report vomiting, stomach pain, and severe constipation. For most people, it fades, but for some, it never does. Here is where it gets serious. A 2024 systematic review published on PubMed analyzed multiple clinical trials on semaglutide. The finding was alarming. Up to 40% of the weight lost on this drug may not be fat at all. It may be muscle, and losing muscle, especially as you age, raises your risk of weakness, bone loss, and metabolic slowdown. This is not a minor side effect. This changes the entire picture, and that is not even the most controversial side effect. Coming up, Scene 8 might genuinely shock you. Dermatologists across the United States have coined a term for what they are seeing in their clinics. They are calling it Ozempic face. A 2023 paper published in the Journal of Drugs and Dermatology described it as a growing social media and clinical phenomenon. As patients lose weight rapidly, the face loses fat volume faster than the skin can adapt. The result is sagging skin, hollowing around the eyes, and an appearance of accelerated aging. Doctors say it is one of the most common cosmetic complaints they are now seeing in patients on GLP-1 drugs. The FDA is very clear Ozempic is not for everyone. People with a personal or family history of medullary thyroid cancer, those with pancreatitis or multiple endocrine neoplasia syndrome should not use this drug, and it should always be taken under direct doctor supervision. So, should you actually take it? The answer depends on something most doctors forget to mention. Here it is. This is the part that nobody in the advertisements talks about. The Step 1 extension study, published in the journal Diabetes, Obesity, and Metabolism in 2022, tracked patients after they stopped taking semaglutide. Within just 1 year of stopping the drug, participants regained 2/3 of all the weight they had lost. 2/3. The hunger came back. The cravings came back. Everything came back, which means for many people, this is not a short-term solution. It may be a lifelong commitment. In July 2023, the European Medicines Agency opened a formal investigation. Reports had emerged linking semaglutide to thoughts of self-harm and suicidal ideation in a small number of patients. The agency reviewed all available data. In April 2024, they published their final conclusion, stating that no confirmed causal link was found between GLP-1 drugs and suicidal thoughts. However, they recommended that monitoring continue. The FDA conducted its own review and reached the same conclusion. This remains an active area of ongoing research. Here is the honest truth. For people with type 2 diabetes, obesity-related heart disease, or a BMI over 30, the clinical benefits of semaglutide are very well documented. The American Diabetes Association and the American Heart Association both recognize it as a first-line treatment option in appropriate patients. And if Ozempic is not right for you, or you simply cannot afford it, research consistently shows that structured dietary intervention combined with resistance training can achieve 5 to 10% body weight reduction without the side effects and without the dependency. Ozempic is one of the most powerful drugs approved in the last decade. But power without information is dangerous. Share this with someone who needs to see it. And if you want more evidence-based health content like this, subscribe.